So our first session is about landscape and framing, setting the tone for the day. We've got a batch of fantastic speakers, and I'm especially excited to introduce our first speaker, Congressman Ami Bera, who will provide some of the opening context for us before we begin the agenda for the day. We will have some Q&A with Congressman Berra directly following his remarks, but because he's only available for a brief time, we won't be able to take audience questions just for this portion of the session. So let me now introduce Congressman Berra. With a 20-year medical career as a doctor and as the former chief medical officer of Sacramento County in California, Congressman Berra has long been a strong advocate of American leadership in global health. He is one of only 14 MDs, medical doctors, serving in the House of Representatives of the United States. He was the first member of Congress to hold hearings on the coronavirus issue and exercise oversight of the federal government's response to COVID-19. He was also among the first people to sound the alarm when the White House disbanded the office in charge of preparing for pandemics and sought to include funds to combat coronavirus over 2 months ago through other legislation. I'm really pleased to welcome Congressman Berra with us today. Congressman, you can now start your slides and start your screen.
Great, thank you. Thinking about how we ended up where we are today really helps us frame where we're going to go. If we look back over the last decade or two, many of us have understood that we were going to see a pandemic coming. We went through SARS, we went through H1N1, we saw MERS, and then the 2014 Ebola outbreak. And many of us actually thought we were fairly lucky not having something like what we're dealing with right now with COVID-19. That's why global health security and the global health security agenda was one of the first key areas that I got involved with when I got elected to Congress in 2013. It's difficult to sound the alarms because it's a small community of folks that are focused on pandemic preparedness. But post the 2014 Ebola outbreak, I think President Obama understood that there were some things that they got right, but there were also some things that they were slow at. So we did a deep dive in 2014 on lessons learned, and that's when you elevated this pandemic preparedness czar to the national security level. We thought that was clearly one of the most important things that we could do, to have someone who was working across the agencies, but also working with the international community and was just paying attention to small outbreaks as they popped up. And that did serve us well during the Zika outbreak. You had early warning signals. You had someone who was in charge of tracking how the outbreak was moving along. You had someone who could talk to the various agencies and make sure we were prepared, and also interact with the public health apparatus here domestically and internationally. You touched on the fact that that position was disbanded in May of 2018. We sounded the alarm at that juncture. We questioned Secretary Pompeo and really said this was going to make us less prepared. We've continued to try to fight to get funding for this. So fast forward to December of 2019. Those of us in kind of the global health security space started to hear reports coming out of China that there was a novel coronavirus that was occurring. And then early January 2020, you saw the unprecedented shutdown of Wuhan and Hubei province. And that's when we knew something was going on. CDC, to their credit, had been trying to get to the hot zone prior to that, and we're not being allowed to get into China. They did have some personnel there, but the best way to get information is to get into the middle of the hot zone. That unfortunately didn't happen. Our first briefing was January 23rd, when the administration briefed both the Senate and the House. That was Tony Fauci, Bob Kadlec, Director Redfield, and others. And the focus at that time from the administration perspective was all on a containment strategy, which was really a travel ban out of China. We sounded the alarms at that juncture, and in the first hearing that we had in Congress in the first week of February, that a travel ban was fine. It was not going to contain this virus because the virus doesn't see borders, and it had already likely traveled outside of China and potentially, as we determined, had likely traveled to the United States already. it would buy us time. And that in that time, we really needed to prepare our public health apparatus, make sure public health departments, hospitals had the supplies that they needed, and we were pushing testing, testing, testing. We lost time, unfortunately, as the CDC decided to devise their own test. I think there was a false sense of security when they announced that they were sending the test out to 50 states and to public health labs. We lost an opportunity there because we assumed that that test was going to be an accurate test that could be quickly ramped up and brought to scale for the massive contact tracing that we needed to do. Unfortunately, we can't get that time back. Fast forward to early March when we had the first community-acquired case of coronavirus in Solano County, ended up at my old hospital, UC Davis. And that's really when it came to light how little testing capability we really had. And that patient ultimately tested positive. Thankfully, that patient has recovered and is back home. But that's when the real alarm bells sounded. And we're only a month away from that point where we started to change the testing criteria and get the CDC to change the testing criteria to where we are today. If you look at the second week of March, people started to put in social distancing measures in Seattle and California. Fairly early on, Governor Newsom here in California, as the first state, went to voluntary stay-at-home orders to fairly quickly to mandatory stay-at-home orders. New York was a little bit after us. Washington State was around the same time as California. We will, as we see this virus kind of unfold across the globe, as well as here in the United States, you're seeing in real time how important those stay-at-home measures were. For my home community here in Sacramento County, what it did do is it really does look like it slowed the spread of the virus. Again, we still expect that we are going to see a peak and a wave perhaps in a week or two, but it did give our hospitals capacity to prepare, the ability to get protective equipment as they could, and hopefully bought us some time to ramp up our diagnostic testing capabilities. Unfortunately, you've seen other states like Florida and Texas that have still not issued mandatory stay-at-home orders statewide, and we've been pushing the administration at the federal level to issue that order as opposed to leaving it to 50 states. I hope Florida and Texas don't get hit as hard as New York, but we will see in real time almost this case control study that's playing out of early states versus late states. And if you watch the president's conference yesterday with Dr. Fauci and Dr. Birx, kind of showing that those graphs, you'll see that we are leveling out in California and Washington, are not going up as fast. And then if you look at New York and New Jersey, unfortunately, and Louisiana and other places, you're seeing this dramatic rise. Let's fast forward and how I think big data and artificial intelligence can help us with the next steps. The conversation in Congress is now moving to, we've got to mitigate this, we've got to control the crisis at hand, we've got to help our healthcare professionals and the public get through the immediate crisis, but we also have to start thinking about what those next steps are. And we are starting to have those conversations. We're also paying attention to Korea, to China, to Singapore, and other places that were a month or two ahead of us in this. So the first thing and first tool that we really need is serologic testing. From that perspective, I think Stanford has this serology and others. So we have the test available. We are now working with the commercial sector and making sure the funding is there to massively ramp up serologic testing. And why that's important, it's different than diagnostic testing. Serologic testing will tell us how many people in the community have already potentially been infected by COVID-19, recovered, and have some level of immunity. That will help us make scientifically based decisions on when can you open up parts of a certain community, when can you open up parts of the country. That massive serology, I think this is where having the ability to use big data to sort through a lot of that and get a sense of, what is the level of immunity, not just in one particular part of the country, but all across this country. So that's going to be very important in helping guide us. A second big issue is it really does seem like there's a temperature sensitivity to this virus. And if you go to the Johns Hopkins website, and they're doing a great job kind of collecting the data on number of cases, numbers of death, and where they're appearing. If you look at the northern hemisphere versus the southern hemisphere, it is quite shocking. The northern hemisphere is all red.
1 minute.
Southern hemisphere is not. So looking at that data, that's going to be extremely important as well. And then the last thing, we've talked about distributing thermometers to every American. As we start to reopen, training them to check their own temperatures. That's going to be a big data set as well. And that could be, as new clusters pop up, it could give us some information on how to move forward. And again, big data is going to be very important in teaching us about this brand new virus. So I will stop with that, and I'm happy to take some questions.
Thank you very much, Congressman Bera. We do have a couple questions for you. And I wanted to begin just by noting that just today in the news, the Secretary General of the UN called this the greatest threat to the globe since World War II. You're a member of the subcommittee chairman, in fact, of the House Foreign Affairs Committee. I wonder if you can speak to some of the global challenges, not just domestic challenges, and perhaps even the opportunities for US leadership to coordinate a global response, precisely for the reason, of course, that the coronavirus doesn't respect national boundaries. And to combat this globally requires global coordination.
Absolutely. The United States is uniquely suited with the resources to, and with the leadership, hopefully, to push the global community to work together here. This is where we've got to learn from each other. Part of the reason why we sounded the alarms early with China is because we actually wanted to learn from China. And I think this is a place where China can really be a world leader as well. We know that there's a high risk of a second surge potentially in the fall if this is a temperature sensitive virus. And how can we get through the current crisis, but also get prepared for hopefully not another surge? We also know if the southern hemisphere is going to be hit harder, places like Africa and elsewhere where they don't have the public health infrastructure could be hit pretty hard. How do we take what we're learning now to help prepare those that may get impacted later?
Russ, do you have a question as well?
Yeah, Congressman, thank you very much. I was wondering if in NDC, anybody is yet thinking about how we're going to unroll shelter in place. I'm sure many people wonder about this, and especially if it's going to be coordinated or if it'll be a county by county basis as it was stood up.
I think in an ideal setting, you would have the federal government coordinating with the states and the local public health authorities. You'd also have the science guiding this. That isn't how this unrolled in preparing for this pandemic. Hopefully we've learned from that and we can do this in a coordinated manner. We do think specific geographies and communities will probably open up first, likely because they were hit first. We have to know what level of immunity exists in a community, and we can start then releasing those folks that have some level of immunity back into the community, either to care for folks that are still ill or to get the economy going again. You'll hear this debate about whether we use face masks on the general public to also reduce spread. We're in the process of getting the CDC to change their guidelines. We do think once we've taken care of our healthcare workers and first responders, then it probably does make sense to make sure the general public, for a limited time, does use that protective face mask. And then it's probably bifurcated. We know there's a very high risk population of those over 60, but really over 70 and 80 that you may have to treat slightly differently, particularly they're very vulnerable versus those under 50. And again, this is where working together as a planet, sharing data, looking at what best practices are, we can learn from each other.
Let me hop in there as well with a follow-up on that. I'm sure many of the people who are watching are looking for a game plan about how we get out of the shelter in place for the very many people who are currently abiding by those orders. Can you say something about what your expectation is with respect to testing, which has been such a difficult issue here in the United States? When can we expect to see much more widely available testing, and how is that connected to getting us out of the shelter-in-place orders?
We've been told a lot by the administration that the testing's coming, I'd listen to Dr. Fauci when he does the press briefings. I do believe Abbott does have a point of service test that should be ready and distributed fairly soon. We're going to need that to make decisions about reopening. And we also know when we're starting to reopen, we will still see pockets of clusters emerging, and we have to have the ability to go quickly into those clusters and do contact tracing so we can contain those clusters if we have second events, et cetera. There's two different types of tests, and it's incredibly important for us to understand. The diagnostic test, which will tell you whether you have the disease or don't have the disease, and the serologic test will be a blood test. It likely will be a finger stick blood test that will tell you if you have immunity to the disease, if you were infected, maybe you never had any symptoms, and now actually have some levels of antibody. That will also be incredibly important in helping us make decisions about how safely to reopen.
1 minute.
Okay, let me ask a final question here. I'm curious if you can say something about how this whole crisis goes far beyond a medical or public health crisis. Some people are calling this the first modern infodemic. And as a public official in a position of responsibility for the health of the country, the well-being of all people, what can policymakers do at this point to ensure that people are getting accurate information? And not being subject to misinformation and disinformation that we see often online.
That's a challenge because early on you saw it coming from the highest levels of government, from the Oval Office briefings. Going forward, we're going to have to learn from this. We're all going to be changed by this because we're all going to be impacted personally in one way or another. What it also is doing is it's accelerating technology changes. The fact that we're doing this video conference, and we're all working from home, et cetera. So those societal changes are going to have an impact as well. So how do we learn from today, but also rethink where we want to be in the future? And I think that's going to be the big challenge for policymakers as well as industry and individual leaders.
Congressman Berra, thank you very much for your time this morning. We're grateful to you for showing up and participating in this virtual conference.
Thank you. Be safe and be kind to one another.
Thank you.